back to my channel. Today's video, I'm on the couch, still in my messy bun, comfy sweater, heating pad, but I had an idea for a video and I wanted to record it while I had the energy for it. So today I'm going to be going over all the treatments, therapies, medications, and things that I have tried, what worked for me, what didn't, and things that I would like to try in the future. Here's a disclaimer. I am not a medical professional. I am not sharing medical advice. I'm just sharing with you what I have tried, what has worked for me, what has not worked for me. So just so you know, if any of these things interest you, then I would highly encourage you to talk to your doctor. I also just wanted to say I was trying to keep it like focused on my EDS, like things that I've tried and am doing to control my EDS, but it's kind of hard to keep out my other therapies and things that I do for my endometriosis and POTS, and so that is included in here because it really affects my EDS. So back to what you were watching. So I'm gonna start off with just I don't know what category they fall under, but basically things that aren't medications, or I guess maybe just things that I have tried. So the first thing on my list is braces. Braces are a huge gold star and a huge necessity for me with my EDS. It's the only way that I've really been able to get a respite from my joint pain and prevent further damage, and so I use braces regularly. Some of the braces that I use the most would be my hip brace, my knee braces, ankle braces. Sometimes I use wrist and thumb braces, and sometimes, actually I think that is all of my braces. Absolutely love them and I need them. Second thing that I've tried is kinesio tape, or just like taping in general, which I also really like taping. The only thing for me is that I have an adhesive allergy, and so whenever I use KT tape I always end up with rashes afterwards, so I try to limit where I use KT tape because depending on where I use it I have worse reactions. So like if I use it on like my hands or my feet, the reactions will be a lot less than when I use it on like my legs or my body. Another thing that I've tried is a TENS machine. So that's basically just like a unit that you put onto yourself and it uses like electromagnetic like pulses. I personally didn't see much improvement when I was using a TENS machine. In certain spots that I would use it, I found that it made the pain worse, and so I currently don't use a TENS machine. Foam rollers. So in the past I have used foam rollers, but the thing that I was finding, or at least in this season that I'm in, my body is just in a really sucky place in my health where when I try to do anything that benefits it, it just kind of sends it into a flare-up, and so I kind of have to pick and choose which things are benefiting me and which things I'll just have to lay aside, and foam rolling is one of those things. It often sends me into a flare, and so I don't typically foam roll right now, but it can be a huge benefit for other people. Heating pads. I'm using one right now. I would literally be dead without heating pads. I use them all the time and I love them. I guess on the opposite end would be ice packs. I have used ice packs in the past, but I usually use them for like fresh injuries, which then I see a benefit, but just like sore joints or muscles or something like that, I find more benefit from heating pads. Essential oils. So this would more so pertain to like helping like my stomach issues. I find the most benefit there from like peppermint oil or something like that. I have used peppermint oil like on my joints before, and sometimes it brings a little bit of comfort, so it's really a hit or miss with essential oils. different kinds of like rubs are also like in that category. So things like BioFreeze or like A535. I had a version of that, but it was just like the diclofenac 8%. It was like from the pharmacy, and that I had a weird reaction to, so I didn't benefit from using the diclofenac gel. Sometimes I use BioFreeze, but again, it's something that only helps like very, very short term. I also had like a natural one for a while, and it can, again, it provides some comfort, but at this time I don't use it. Along with that, I've also tried CBD cream. So this is just the CBD, not THC. And sometimes I find a benefit and sometimes I don't. Like, for example, I slept funny last night, and so my whole like left side is kind of out of place, and so my shoulder keeps slipping out. And so when my husband would go to massage the ligaments and tendons that have like slipped out of place, he would use CBD to bring some comfort to that area while he's massaging. And so in that way, I do find that it helps, but again, I use it pretty sparingly. So use whatever works for you. Moving on to like medications that I've tried. So when I was like very new to my journey, I was having such bad hip pain. I had gone to my doctor and he prescribed me like prescription strength naproxen. I honestly didn't see a benefit to my joints while I was using it, and I was afraid of like the side effects because it can cause like a lot of negative like abdominal symptoms, and I didn't want to make my already poor digestive system worse, and so I didn't see a benefit while using naproxen. So I do use Aleve at times, but again, I use it pretty sparingly. So it's a sometimes for me. Tylenol arthritis. So this is something that I have surprisingly seen a huge benefit for myself. I get like this, like, I don't know, it just feels like my joints are like screaming, if that makes sense. And I find that when I use Tylenol arthritis, it just kind of like takes that searing pain that is in my joints and just kind of numbs it. So I often use this at night because it's like at night when you're trying to fall asleep, you can't get comfortable, all your joints hurt and you just can't sleep. I will usually use Tylenol arthritis and it just numbs that right down so that I can go to sleep. So going with that, I recently started trying amitriptyline. I haven't noticed a huge benefit yet, other than it helps me sleep like through the night instead of waking up consistently. So I guess there's that benefit, but I haven't seen a huge benefit to like my joints. Supplements. So in the past, I was very like pro natural, like anything that I could possibly do that was natural is something that I would choose over something that was like pharmaceutical. And I wouldn't say I'm not against natural things. My body has just reached a point where sometimes pharmaceuticals are just more beneficial in my current stage of life, but I also always try to find natural alternatives to try and help myself. And so in the past, I have tried collagen, which I have EDS. I have a disorder that affects the production of collagen, and so adding in more collagen, I can honestly say I did not see a benefit to my joints. It never stopped them from hurting. I would say like I was taking collagen alongside biotin, and so the two of those combined made my hair and my nails amazing, and maybe like my skin cleared up a little bit better, but I didn't notice any improvements in my joint function while I was on it. Another one that I used for that was MSM, sorry. And again, I think I noticed that it helped take that sting out of my joints, kind of like how Tylenol arthritis does, but it was giving me like really vivid dreams. and not good ones. And so I did stop using it for that purpose. Some other supplements that I have tried are like turmeric and serapeptase. Serapeptase is a natural anti-inflammatory. Those two, I think I saw a pretty huge benefit in just how I felt overall, because inflammation plays a huge part in like just overall pain. And so this is something that I would try again, but supplements are really expensive and they aren't covered by most insurances, so that's something that you pay out of pocket. And for like a month's supply of a supplement is like $30 to $60 a bottle sometimes, and that can be really pricey, especially when you're on multiple different supplements. And so I was on a bunch of supplements because I was seeing like a naturopath who did iridology, and I did benefit from it in the past. I just got to a place where I was like, you know what, I just can't afford this on top of other therapies, and so it just kind of had to go. So I would try turmeric and serapeptase again at some point. So therapies that I've tried. I have tried physio, like every EDS person. I think every single one of us, I think, has tried physio at some point in our lives. I did physio for like 2 straight years, and I was not able to progress to a place where I was benefiting from it for my joints, because I also have endometriosis, and what I was finding was a lot of the like strengthening physio exercises would set off a flare-up in my endometriosis pain, and so I wasn't able to progress with that. And also during the time that I was doing physio, I was working a full-time job, and I really had to choose between being able to function for my full-time job or try to like improve my joints, and the two were just not, they were just kind of butting heads, and so I had to give up physio for that period of time. But it is something that I would come back to. It's just that we kind of have to get some other things in my body to a better spot before I go back to that. Another thing that I've tried is seeing an osteopath. So it's kind of like massage, but way more gentle and more like triggered points in your body. And this I found a huge benefit in. I was using it for my endometriosis, but also for TMJ and like occipital nerve pain. I found a huge benefit. I had been having like awful TMJ issues. My jaw was just always clicking and in so much pain I could hardly talk. And I had gotten my chiropractor to put it back. I had gotten my massage therapist, I think, to like massage it, or I think that was even my physio who did massage on it and stuff. And we just could not get it to a good point. I saw the osteopath for it. It has not been that bad since. So, and that was like years ago at this point. It's still like painful and I do have flare-ups of it, but it has been better. It was better for a long time, I should say, after seeing the osteopath. And just osteopaths in general, they have a better understanding of like connective tissue. This osteopath even knew what EDS was, and so he kind of knew the pathways in my body a little bit better than maybe just a normal massage therapist, if that makes sense. Which, going into that, I have also seen a massage therapist. Like, I have gone to massage a couple of times. I just personally think that I haven't found a technician who knows my body well enough to make it benefit me, if that makes sense. Like, my husband will massage me when I need it, and he's really, really good at it, and then I find a benefit because my husband knows my body, versus some random stranger who doesn't know how an EDS body works. I always just found it was like way more painful and not as beneficial, and so I'm still looking for someone who understands my body enough to try massage again. I've also seen a chiropractor in the past when I was having really bad neck issues, and I did see a benefit back then, but then as soon as I found out I had EDS, I did stop going just for safety purposes. That was just a personal choice. Some people might benefit from it, some people might not. It's all your decision, basically. With physio, I did try acupuncture, which I wouldn't say I saw a huge benefit, and I don't really love having like needles jammed into my body, so it's not something that I would maybe try it again, but I just haven't seen a benefit from it. And along with that, I have tried dry needling, and I absolutely hated it. It was so painful, and I did not benefit from it, and I had like a lot of bruising afterwards because of my easy bruising from EDS. And so it's just not something I would do again. It was also like during the dry needling, I was having a lot of like reactions of my POTS because it does send off like a vagal nerve response. And so I was feeling like passing out a lot while they were doing the dry needling, and not because I'm afraid of needles. And so I just personally would not do dry needling again. Something that I would love to try if we had something in my area for this, I would love to try red light therapy. I have a family member who has an infrared sauna, but at this time I can't try that out because of my POTS, and infrared saunas are different than light therapy. And so if we had somewhere that was for like therapeutic, like red light therapy, I would love to try that. I know that tanning salons often have that, but I think the ones that we have in my area also do the tanning at the same time, and I don't want that. So if I could ever find a red light therapy place for therapeutic purposes, I would totally try that. What are the current things that I am doing or using to help my Ehlers-Danlos syndrome? So along with Ehlers-Danlos syndrome, I have a lot of other conditions, and so a lot of the time I think EDS people are fighting our other conditions to try and stabilize those things so that we can better stabilize our EDS. And so right now I've been fighting my POTS a ton, and so I'm on a bunch of POTS medications to try and keep my heart rate regulated, and using salts and electrolytes and compression socks, anything that I can to try and get my body to regulate heart rate naturally, basically, or like on its own, not naturally because I'm on medication, but to help my heart rate actually regulate. So I guess the ones that I've tried and did not benefit from would be propranolol, which a lot of people do benefit from it, but personally, any medication that has a super duper long list of side effects just comes with a lot more risk for me personally. I'm really sensitive to medication, to treatments, to supplements. If there is a side effect, it's most likely to hit me, and so I did not benefit from propranolol. I had way too many side effects. I could not function properly, and so I came off of that one really quickly, and I have tried 4 total POTS meds, and I'm on 3 out of 4 of those. And so the ones that I'm on are midodrine, ibuprofen, and mestinon. Those are the 3 that I'm on to manage my POTS right now. Currently I take like a laxative gummy. It's called Keep It Movin' by, I think it's the brand Ollie, I think, and I have seen a good benefit from that. And so I have continued to use that because I find that other laxatives are just way too harsh. I'm not looking for a cleanse. I'm just looking for a way to naturally keep things moving, and I feel like this is what that gummy does. And so I've been on that. I also use bloat gummies by the brand Suku, and I love those. I feel really sick really quickly after meals, and I find that these bloat gummies help to manage that overwhelming sense of sickness really quickly, and so I use those just about every meal. I also currently use nausea meds as needed, both metoclopramide and ondansetron, which for all you Americans, that's Zofran. So that's like the combo that I use when I get so nauseous that I feel like I'm gonna vomit, and I don't like vomiting, so then I take nausea meds, but I usually try to fight it as long as I possibly can. So I guess along with that, I do ginger ale a ton. If the bloat gummies and the ginger ale aren't cutting it, then we'll bring in the nausea meds. Something that I'm also currently doing amitriptyline, like I mentioned, is something that I'm currently trying for pain. Tylenol arthritis is something that I use for joint pain. I still use my braces and my tape. I still use my cane. Oh, I think I forgot to mention that in my other category. I use a cane when I go out in public because I am just at a point where I can't physically walk very far. It aggravates my pain, it aggravates my POTS, and so I use a cane to help better balance myself. It also just adds another point of what's the word? Brain fog. It just adds stability, basically. I'm able to lean on it, takes the pressure off my hips, helps me slow down when I'm walking so that my POTS can better regulate, and so that is something that I use currently. Therapies that I currently do are pelvic floor physio. I do that every month. We're not able to progress at this time just because of my other conditions, but I do find that it is beneficial, and so we've worked out a routine that works for my body, and so I am keeping up with that. And then I also do bioresonance therapy, and I've been doing that for years for my endometriosis, and it's really been the only thing that has kept my endometriosis somewhat in check without the unnecessary side effects of birth control or hormone therapy. Yeah, basically that. And then I guess I use a heating pad, life changer. And soon I will also be starting IV fluids once a month to try to help better hydrate myself, because I'm not really able to do that orally right now. And also for my POTS, because summer is coming and I don't do very well in the summer, and so I'm very happy to be able to get access to that this summer. And then I will also be starting on IVIG, which is supposed to help my POTS, hopefully. I'll be taking you along on all the things, and so I can let you know if they're helping. But I hope that you found this video beneficial. If you did, please give it a like, and if you would like to continue to follow along on my journey, then I would love to have you subscribe, and I will see you next week. Bye!